Katrina threw a lot of things into focus, but one of them was how tragic it is to not just lose your home, not just to lose a practice, but to also lose the history, to also lose your records. What was the story for this person's healthcare?
No, my mother suffers from congestive heart failure. Her eyes is so glossy now. I need to get her out of here. This is ridiculous.
I haven't been back on the loading dock until today. So the last time I was here was in August of 2005 for Katrina. It's a little strange, I must say. Lots of memories about what happened there. Essentially, the Superdome became an island, as did the arena. And at that point, we had folks that were walking in through the water. And it was very difficult whenever folks would come in because, you know, one of the saddest things is they had done exactly what they were told to do. They brought their medicines with them. They brought some clothing and food for 3 days because that's what you were supposed to do when you evacuated. But they would come in and we were trying to triage people with chronic illness, and their medicine bottles had been brought in a Walmart bag, which, by the way, is not waterproof. And so when you opened up the bag and looked at the medicines, the labels had been washed off in the floodwaters, and the pills inside were a white slurry. Patients really were of the impression that because they saw computers in their healthcare setting, that somehow all of the information was in that computer, and wherever you went, that information was going to be available, just like you could go to an ATM and draw out money. And that was not the case. With only 10% of the physicians having electronic records when Katrina hit, that meant that the 90% who were on paper most likely didn't have records anymore because they drowned. So we lost a ton of paper records. That's a huge loss, especially with the amount of chronic disease in this state, let alone in this city. To have that many people with no medical history available to them, that's unimaginable. There are so many people with diabetes living in New Orleans that we set up almost half of the field as an area where those patients could be managed. And it was hard for the patients because they didn't understand why we didn't know, why I couldn't go to the computer and pull up their information.
This is my mother. She needs heart medication. There's no medic. There's nobody here. And she needs to get to a hospital immediately, and so do I.
So it was frustrating for them at a time when they're nervous. They're scared. Their city's flooding. They don't know if their home is still there. And you pile on top of that, we can't even meet their basic chronic medical needs. We can't even do that. What I want to do with my life is take care of people, and I am being essentially, tied down because the record that exists on paper, what we knew at that point, those records were probably lost forever. And there's no way to get all of that information back. There's just no way. I think the real lesson from a healthcare perspective is that we owe it to the patients. We have the best healthcare system in the world, but it failed so miserably at Katrina because of our inability to share information.